With Anne and Evelyn, who have petitions going to the States on Tuesday about the use of cannabis or derivatives of cannabis. First of all, let's start with Anne. Give us a brief history. Why do you want to use such substances?
Well, I've got multiple sclerosis, and one of the symptoms is muscle spasm. It can be small spasms in your hands, it can be spasms anywhere in your body, basically, because the disease is concerned with lesions in your brain and your spinal cord, which then of course lead to everywhere else in your body. So the nerve signals get kind of mixed up. So it gives you all sorts of symptoms. You know, I choke quite a bit, and you know, my bladder and my bowels don't do what they ought to do when they ought to do it.
Obviously a lot of people have MS. Do other people use cannabis type products?
Possibly. It's not something only some people will admit to it, because you never know how far it's going to go and who's going to be knocking on your door, so to speak.
I'll have a word with Evelyn, but your requirement is for something slightly different. It's a cannabis, but you want original cannabis, as people get prosecuted for having the cannabis. That's the sort you want, isn't it? Why is that?
Because I've actually tried all the other cannabis-derived products. I've done the Nabalone trials, I've done Sativex trials, 2009 and again in 2011. For the muscle spasms I was having in my gut, it is a good painkiller, but it did not give me an appetite, which smoking the natural product, obviously the plant, it helps me have an appetite. It slows my transit time down, so rather than draining my bag every 11 to 15 minutes, I'm draining it every couple of hours. So I get to hold on to the nutrients and all the minerals and everything which I get from what
I've interviewed you previously, and we've seen in graphic detail the bag you have and the way that you are very restricted. You've got a lot of bits missing from your inside, and it's all a big digestive problem. But one of the things about cannabis, as I understand it, if you smoke it, you can absorb it, whereas you can't with tablets.
Yeah, because my transit time, I've actually got short gut syndrome, and because my transit time is so rapid, I have to take or rely upon Imodium, loperamide, which does cause a lot of other problems if it's taken long term. At the minute I should be taking 60 capsules 4 times a day, which the required amount is no more than 8 in 24 hours.
Now you have the benefit, you've actually taken cannabis, the type you want, and you know it works for you.
Definitely. I'm living proof it works.
Yeah.
Obviously I have to do it and go against the law. I'd rather do it the right way.
You've got specialists in the UK. What do they say about you? Because they know you take cannabis in the formula. What do they say about it in the UK?
My consultant actually gave a brief interview to the BBC, which is on the BBC blog, I believe. I've viewed it there. And he said it's within their best interest of the government to allow me to have the cannabis.
If you were prescribed it, or it was made available that you could have it, what would be the cost per month for you to have what you want, do you think, in Jersey?
If I was allowed to grow my own plant, it wouldn't cost the government anything. Right. I'd do it myself.
And if you had to buy it, I mean, of course, the false discussion now is, of course, it's illegal to buy it, so it's inflated prices, so that we don't know what it would actually be if it was produced properly chemically, do we?
No, well, at the minute, to buy 1 gram of cannabis, they're charging between £15 and £20, and as it's coming up to Christmas, the prices are actually going up, which I can't afford.
Christmas present for you, Anne. What would be Sativex? I think is the product you're looking at. You haven't actually tried Sativex.
I haven't tried it, and I would like to try it for a couple of months to see how, you know, the effect of it. And I understand that Sativex can be prescribed in Jersey by a doctor. It is legal to actually have it prescribed and to have it fulfilled on the condition that you pay.
Which is what Evelyn did. Evelyn did have it, and you did pay for it, so Evelyn can tell you exactly what it cost her.
Yeah, yeah.
And
well,
it's expensive.
It's in the region of 300, and
it's expensive for you, but it's not expensive as a drug prescribed through the system, because there's lots of very expensive drugs out there, aren't there?
Yes,
or
indeed
treatments,
there are.
medical treatments, whatever they call them.
Yes, I know one drug I was on once, well, I still am on, but the price has come down. It was about £250 a month.
If you were on Sativex, do you know in what form it would be? Would it be tablets or a spray? I believe there's a spray
It's
form.
a spray,
Right.
it would be a spray.
So that makes it more absorbing, or you can absorb it
Yes,
easier.
and it absorbs more quickly through the mucous membrane.
Right. I understand that, Evelyn, you have heard of people with MS using products, cannabis products. Do you know how what they use?
Yes, they do. I've actually used the Sativex, which, as I said, is sublingual, and it does get absorbed through the saliva membranes. But for me, it's not
But for
the way to
what
go.
do you know about MS users? Because this is the specific problem. There's a lot of people with MS out there, and if it was giving people pain relief and so on, it would be of benefit to a lot of people, wouldn't it?
It would be a great pain relief for people and patients that are suffering from MS. I do have one friend who does suffer from MS, who has his medication every 3 months, I believe, through intravenous. But he does smoke cannabis, which does alleviate his pain.
The strange thing is they're quite happy in the system to prescribe people on opium derivatives. They seem to have no problem about that. But this, which is in the list of dangerous drugs, it's much less dangerous than opium, isn't it? But they seem happy to prescribe opium for people. Like, I must admit, I'm having some difficulty understanding that. Do you understand? What do you think about that?
Well, I mean, it's ridiculous because there are many people with a variety of diseases who are prescribed morphine, heroin, and obviously you've got to have a need for it, but they are prescribed it, and it's not a sort of amazing thing to have it prescribed.
Of course, we get all the dire warnings about all the side effects of cannabis, but of course, all medications, I mean, I take various prescribed substances for gout and different, but if you read the side effects, they're horrendous. You know, nobody would take anything if you read all the side effects, would they?
Yes, that's absolutely true.
And you've been in nursing, you know what goes on. I mean, you've seen the use of.
When I have a new tablet, I always read the piece of paper that comes with the medication. I only ever read it once, but when you read through it, I mean, the list of things that could happen to you is absolutely dire.